A girl sat tensely in the clinic, avoiding eye contact and fidgeting in her seat. Her nervousness initially seemed like ordinary appointment anxiety, but everything changed when the doctor conducted an ultrasound. He stared at the screen in stunned silence, then panic crept into his features. The early evening light settled over Santa Rosa, a quiet city tucked in the heart of Sonoma County, California. Dr. Evan Lom checked his watch as he exited the exam room. At 52, he was a well-regarded family physician, having opened his independent practice just a few years prior. Business had been growing steadily ever since. "Rosa," he called as he approached the nurse's station, holding up a small case. "Mrs. Hernandez left this behind." He handed over a prescription eyeglass case to the nurse on duty. "I'll give her a call," Rosa said, taking the case and tucking it into a drawer. As Dr. Lamb turned to return to his office, he scanned the now mostly empty waiting area. It was nearly closing time. In the far corner, he spotted a man in a blue polo shirt and a girl in a red hoodie sitting quietly. Recognition flickered in his eyes. "Marco," Dr. Lamb called out with a friendly wave as he approached. "Marco Halen, right? I didn't know you had an appointment today." Marco stood and extended his hand. "Dr. Lamb, good to see you. We're neighbors, Marco. Outside the clinic, you can call me Evan." He glanced at the girl, who sat motionless, her gaze fixed on the floor. "And this must be Lucia. We haven't officially met, but I've seen you around." Lucia gave a slight nod, eyes never leaving the ground. "We'll be with you shortly, Doctor," Lam assured them. "Just wrapping up a few things." Back in the exam room, he sat at his desk, sorting through patient charts. Moments later, Rosa Delgado entered and began sanitizing the table and equipment. Lowering her voice, she said, "Doctor?" "Lam, something feels off with that father and daughter out there." He looked up from his paperwork. "What do you mean?" Rosa paused as she wiped down the ultrasound machine. "When I took the girl's vitals, the father wouldn't let her speak. Not even her name. He answered everything for her. I kept reminding him I needed to hear from her, but he just kept interrupting. And the girl, Lucia, she wouldn't look me in the eye, not once." Dr. Lam leaned back in his chair, brows furrowed. "I know them, Rosa. They live just a few houses down from me. Marco can be firm. Some fathers are like that." I'm Mexican too, Dr. Lam," Rosa said evenly. "And this isn't cultural, it's something else." She paused, then shrugged lightly. "But you know them better than I do. Maybe that's just how their family works." She handed him Lucia's chart. Dr. Lam's eyes widened as he scanned the notes. 14 years old, showing pregnancy symptoms, he murmured. Rosa nodded grimly. "That's why I'm worried." Dr. Lam straightened his white coat and composed himself. "Send them in." A moment later, the door opened and Marco entered, guiding Lucia forward with a firm hand on her shoulder. The girl walked stiffly, like each step took effort. Her red hoodie hung loose on her slight frame, and she avoided eye contact as she perched on the edge of the examination table. "Thank you for seeing us, Doctor," Marco said, taking the chair beside her, "especially this late." "Of course," Dr. Lam replied. "What brings you in today?" Marco cleared his throat, clearly uneasy. "It's not easy to say this, but my daughter is pregnant." Though he had already seen it on the chart, hearing it aloud made something in Dr. Lam's stomach twist. He looked at Lucia, who sat silently with her hands clenched in her lap. "I see," he said gently. "Lucia, how have you been feeling?" Before she could speak, Marco cut in. "She's been nauseous in the mornings, fatigued, and lately she's been complaining about abdominal pain." Dr. Lam kept his eyes on the girl. "Lucia, would you prefer to answer some of these questions yourself? She gave the faintest nod. Dr. Lam softened his tone. Lucia, can you tell me how this pregnancy happened? Before she could respond, Marco answered firmly. She has a boyfriend. We're not going to talk about him. His tone made it clear the subject was closed. Doctor, Marco continued, leaning forward, we need this kept confidential. No one can know, not our neighbors, not anyone. Patient confidentiality is standard protocol, Mr. Halcone, Dr. Lam replied. I can't discuss any patient's case with others. Good, Marco muttered, settling back in his seat. Turning back to Lucia, doctor. Lam said, I'd like to perform an ultrasound to check on the baby and determine how far along you are. Is that okay with you? Lucia nodded slightly, still not looking at him. Rosa will help you onto the table, he added as he readied the ultrasound machine. You'll need to lift your shirt just above your belly. Rosa guided Lucia gently to lie back. The girl winced. Does that hurt? Rosa asked softly. Lucia nodded. The abdominal pain's been getting worse, Marco said from his chair. Dr. Lam applied the gel and moved the transducer over her abdomen. Lucia flinched at the touch. He stared at the screen, adjusting the settings for a clearer view. This is, he began, squinting at the image. Lucia, you appear to be approximately 28 weeks pregnant. Marco sat upright. That can't be right. It hasn't been that long. Dr. Lam looked at him directly. Have you taken her to see an obstetrician before? Marco shook his head. Number, this is the first time we've come to a doctor. Dr. Lam continued scanning. It's a girl, he said, then paused, his expression darkening. But I'm seeing signs that concern me. Her abdomen isn't measuring as expected for 28 weeks. That suggests intrauterine growth restriction, what we call IUGR. What does that mean? Marco asked. It means the baby isn't growing at a normal rate. It can result from problems with the placenta, the mother's health, or certain fetal conditions. He adjusted the probe again, narrowing his focus. I'm also detecting an irregular fetal heartbeat. He turned fully toward Marco, his voice firm. Mr. Halcon, I strongly recommend you take Lucia to the hospital, immediately. She needs specialized care that I can't provide here. Marco's expression darkened. Why can't you just give her some medicine? This isn't something medication can fix, Dr. Lam explained, keeping calm. The hospital has advanced equipment and specialists. They'll be able to perform Doppler studies to monitor blood flow and detect any underdevelopment in the baby's organs. Marco looked hesitant, defensive. I can prescribe prenatal vitamins, calcium, and folic acid to support her nutrition, Dr. Lam added, scribbling a note onto a pad. But that alone won't be enough. He tore off the prescription and handed it to Marco. There's a pharmacy next door. They're still open. You can fill this while Rosa helps clean up and get Lucia ready. Marco glanced between the doctor and his daughter, uncertainty written across his face. She'll be fine, Dr. Lam said reassuringly. We'll clean off the gel and print the ultrasound images. She'll meet you at the pharmacy in just a few minutes. Marco hesitated, then took the prescription and left the room, glancing back at Lucia one last time before the door shut behind him. As soon as he was gone, Rosa began gently wiping the gel from Lucia's stomach. You're going to be okay, sweetheart, she said softly. Lucia's eyes welled with sudden tears. Her voice was barely a whisper. She kicks when she hears his voice. Rosa paused mid-motion. Dr. Lam looked up, alert. I hate that she likes him, Lucia added. The words dropped into the silence like a stone in water. Rosa and Dr. Lam exchanged a tense glance. Lucia, Dr. Lam said carefully, his voice steady. "What do you mean by that?" But whatever door had opened inside the girl had already shut. Her gaze drifted away, her expression blank again. Dr. Lam tried to interpret the cryptic statement. Maybe it was resentment over the pregnancy. Maybe she was projecting complicated feelings onto her father. Or maybe Marco had reacted badly when he found out. And this was her way of expressing that hurt. "What's done is done," he said gently. "Your father brought you here because he's concerned. Now, our job is to make sure you and the baby stay healthy. That's why going to the hospital is so important." He handed her the printed ultrasound image. Lucia took it silently, staring at the fuzzy black and white blur, unable to make sense of it. Through the frosted glass panel in the door, Dr. Lam saw Marco returning from the pharmacy. The moment was gone. Rosa helped Lucia sit up, her touch gentle. They straightened up the room as Marco stepped back in and placed his hand firmly on his daughter's shoulder, guiding her out. Once they were gone, Rosa returned to the exam room, her face troubled as she gathered the last ultrasound printouts. 9 o'clock, she said, glancing at her watch. "That's it for today, right?" Dr. Lam nodded, still staring at the door. Yes, they were the last. Rosa shut down the ultrasound machine. Her movements were brisk, but her brow was furrowed. "That was strange," she said after a pause. "A girl hiding a pregnancy for 28 weeks? And what she said after he left?" "I know," Dr. Lam said, leaning against his desk. "It was definitely unusual." "What do you think she meant?" Rosa asked, her voice low. "About the baby kicking when she hears his voice, and her hating that the baby likes him?" Dr. Lam ran a hand through his hair, frowning. "I don't know. Maybe she hid the pregnancy because she was scared of how her father would react. Maybe there was anger, and that's what she's expressing." Rosa didn't look convinced, but she was specific. "When she hears his voice." "That's not a general complaint, that's something else." He nodded slowly. "It could just be hormones. Pregnancy does strange things, especially when you add in teenage emotions." "Maybe," Rosa said, though doubt still clouded her face. "I just hope they listen to you. That girl needs help. So does the baby," he said quietly. "They both do." They finished closing the clinic. The rest of the staff had already gone, leaving just the two of them to lock up. As they stepped into the cool night air, the parking lot was still and mostly empty. "Good night, Doctor," Rosa said, heading to her car. "Night, Rosa. See you tomorrow." Dr. Lam climbed into his sedan and started the engine. As he drove home through the quiet neighborhood, his thoughts kept circling back to the exam, to Lucia's words, to her silence. As he neared his house, he slowed. The Halcon home, just 3 doors down, glowed with light. Their car was already parked in the driveway. "They didn't go to the hospital," he muttered, concern tightening in his chest. He pulled into his driveway and cut the engine. He sat there for a moment in the stillness, trying to talk himself into walking inside, having dinner, letting it go. He had done his part. He wasn't responsible for what came next. But Lucia's voice echoed in his head. She kicks when she hears his voice. I hate that she likes him. With a quiet sigh, Dr. Lam opened his car door and stepped back out into the night. He walked the short distance down the street. The Halcon house looked peaceful from the outside, the windows casting a warm glow onto the lawn. He hesitated at the porch, then knocked firmly on the door. After a moment, it opened. Marco stood there, surprise flashing across his face. Marco's expression flickered with something unreadable before settling into a neutral mask. "Doctor, Lam, is everything okay?" "I was just checking in," Lam replied, keeping his tone light. "I noticed your car was still here and was concerned." I had recommended that Lucia go to the hospital right away. Marco's face didn't change, but there was the faintest pause before he responded. Ah, yes. Thank you for your concern. Lucia's gone to the hospital with her mother. I stayed behind to finish some work. Lam blinked. That was the first mention he'd heard of Lucia's mother. I see, he said carefully. That's good to hear. I was worried about the baby's condition. Yes, well, she's in good hands now, Marco said, his tone clipped and final. Thank you for stopping by, Doctor, but it's getting late, and I have work to do. Of course, Lam nodded. Sorry to bother you. Good night, Mr. Halkin. Good night. The door shut with quiet finality. Dr. Lam stood on the porch for a moment, unsettled. As he walked back home, Marco's explanation echoed in his head. Something didn't sit right. In his kitchen, Lam opened the fridge, staring blankly at its contents. His appetite had vanished, smothered by unease. He finally pulled out a container of leftover chicken pasta and placed it in the microwave. As it warmed, Rosa's voice echoed in his thoughts. Her unease, her instincts. The way Marco had dominated the visit, answering for Lucia. The way the girl had avoided eye contact. That strange, chilling comment. She kicks when she hears his voice. I hate that she likes him. And now this. Marco, claiming Lucia had gone to the hospital with her mother. A woman Lam had never seen. The microwave beeped. Lam barely noticed. He'd lived just a few houses down from the Halcon family for over a year. In all that time, he'd rarely seen Lucia, never with her mother. He knew Marco had a daughter, sure, but their interactions had been limited to the occasional wave from the driveway. As for his wife, when was the last time he'd seen her? Had he ever? He carried his dinner to the small office off the living room, just a desk, some shelves, and his laptop. He sat down, hesitated, then opened Facebook. This probably crosses a few lines, he muttered, but something's not right. He typed in Marco Halcon and found the profile easily. Privacy settings were minimal. He scanned the photos, the posts, the friend list, looking for someone who might be Lucia's mother. Then he saw it, Daniela Rivera. The name triggered a faint memory. Her profile picture showed a woman with gentle features that subtly echoed Lucia's. He clicked, scrolling through what little was visible. There were pictures from work events, outings with friends, but nothing with Lucia, nothing with Marco, not for years. If they're divorced, that would explain it, he thought. But then why lie? Why say she's with her mother now? Driven by a sense of urgency, Lam clicked the message icon and began typing. Hello, Miss Rivera. I apologize for contacting you this way. My name is Dr. Evan Lam. I'm a family physician and saw your daughter Lucia today. I just wanted to check in and see how the hospital visit is going. Sorry for the intrusion. He hesitated over the send button, knowing this could backfire. But concern for Lucia pushed him forward. He clicked. Lam ate his dinner distractedly, eyes flicking back to the screen. Nothing. He washed his plate, changed into sweats, and got ready for bed. Just before turning in, he checked his phone one last time. A new message, Daniela Rivera. What hospital visit? Is something wrong with Lucia? Before he could respond, the phone rang. A Facebook call. He answered immediately, Hello, doctor. Lam speaking. Doctor, what's going on? Daniela's voice was tight with fear. What do you mean a hospital visit? I'm not at any hospital with Lucia. Lam's stomach dropped. Miss Rivera. I saw your daughter at my clinic this evening. Marco brought her in. She's pregnant, about 28 weeks along. There was silence, then a sharp breath. That's impossible, Daniela whispered. I haven't seen Lucia in nearly 3 years. Marco and I divorced 10 years ago. He has full custody. I'm not even allowed near her. Lam closed his eyes as pieces began to fall into place. "Miss Rivera," he said gently, "Lucia is in her 3rd trimester. The fetus shows signs of intrauterine growth restriction. That means it's not developing properly, possibly due to placental issues or other complications. I also detected an irregular heartbeat. I told them to go straight to the hospital for Doppler studies and further monitoring." He paused, trying to deliver the facts with care. "This isn't something that can wait. If the baby's organs, especially the lungs or brain, are underdeveloped, we may still be able to intervene, but only if she gets care right away." Daniela didn't respond for a long moment. When she finally spoke, her voice was shaking. "Oh my God, my baby? She's only 14. How could this happen? Who did this to her?" "Marco said she has a boyfriend," Lam replied cautiously, though he now doubted every word that man had said. "I don't know what to do," Daniela said, breaking down. "I want to see her, but I can't. The court won't let me near her. There's a restraining order." Her voice broke. "Please, doctor, make sure she's okay," Daniela said, her voice shaking. "If she's not, call the police. I don't care if Marco reports me for violating the order. This is my daughter we're talking about." "I understand, doctor," Lam said calmly, trying to steady her. "But we need to be careful. Lucia's condition is fragile. We can't risk triggering premature labor by causing her more stress." Daniela exhaled slowly, reluctantly. "You're right. What will you do?" "I'll check on her again," Lam promised, "and I'll keep you updated. For now, it's best if you stay where you are." After ending the call, Dr. Lam opened his laptop and accessed the clinic's electronic medical records. He pulled up Lucia's ultrasound scans and reviewed them carefully. The findings confirmed his earlier diagnosis: intrauterine growth restriction, signs of compromised placental function, and decreased blood flow to the fetus. Oxygen and nutrients weren't reaching the baby the way they should. It was a situation that could deteriorate quickly. The clock on his bedside table read 10:15 p.m., too late for house calls. But this couldn't wait. Marco had lied. Lucia hadn't gone to the hospital and the baby might be in danger. Lam couldn't ignore that. He changed back into street clothes, grabbed his keys, and stepped into the night. The air had turned cool, a thin fog curling through the quiet neighborhood. The Halkin house loomed ahead, its windows still glowing with warm yellow light. He approached the front door with quiet resolve and knocked firmly, rehearsing his words. But when the door opened, it wasn't Marco who stood there. It was Lucia. Her eyes widened when she saw him. "Dr. Lam," she whispered, glancing over her shoulder. "Lucia," he said gently, "did you go to the hospital?" She shook her head, fingers nervously tugging at the hem of her hoodie. "Lucia, I need you to be honest with me," Lam said quietly. "What's going on? Why did you hide the pregnancy for so long?" She opened her mouth to respond, but a voice bellowed from inside. "Who is it, Lucia? Is that the delivery guy? What's taking so long?" Fear washed across her face. "Please go," she whispered, already pushing the door closed. "Please." Lam placed a hand against the door, stopping it from shutting fully. "Lucia, I can help you. Let me help." "I can't," she breathed. And then she closed the door. Lam stood on the porch, torn. Technically, he had done what he was supposed to, warned the father, advised hospital care, but nothing about this felt right. The dread in his chest had only grown. He turned to leave. The door opened again. This time, Marco stood there, his expression dark. "Dr. Lam," he said tightly, "why do you keep coming to my house? It's late." "Mr. Halcon," Lam said, keeping his tone even, "I'm concerned about Lucia. You told me she went to the hospital with her mother. That's not true. Marco's jaw tightened. You've been checking up on me? I'm her physician. Her health is my concern, Lam replied. The baby's condition is serious. Delaying treatment could cause real harm. Marco opened his mouth to retort, but then a light flicked on in the house next door. A curtain twitched. Someone was watching. His demeanor changed instantly. Perhaps we should talk inside, he said, voice suddenly calmer. No need to wake up the neighborhood. Lam hesitated, then nodded. Marco stepped back, and he entered the house. The living room was sparsely furnished, an old couch, a scratched coffee table, and a muted TV flickering silently in the corner. Lucia sat on the edge of the couch, her hands folded in her lap, eyes downcast. Lucia, Lam said softly, how are you feeling? She's fine, Marco interjected before she could speak. Just tired. Pregnant girls get tired, don't they, doctor? Lam turned toward him. Mr. Halcon, you need to understand. The ultrasound showed intrauterine growth restriction and an irregular fetal heartbeat. These are serious. She needs care tonight. Marco raised a hand, palm open. And she'll get it, first thing tomorrow morning. Why wait? Lam pressed. Why not go now? Because it's late, Marco snapped, gesturing to the clock. She's exhausted. Dragging her to the ER just to sit around for hours isn't what she needs. She may not have hours, Lam replied. The baby could already be in distress. Every moment matters. Marco's eyes hardened. The baby won't die overnight. Lam flinched at the coldness of the words. Before he could respond, the doorbell rang. Marco turned toward it, visibly relaxing. That'll be dinner. I ordered pizza. He turned to Lucia. Wait here with the doctor. I'll get the food. As Marco stepped out of the room, Lam moved quickly to Lucia's side. Are you okay? He whispered. Is there something you need to tell me? Lucia's eyes flicked toward the door, where Marco's voice could be heard joking with the delivery driver. Then she reached into her hoodie pocket and pulled out a small stack of folded photographs. She pressed them into Lam's hand just as Marco turned back toward them. Lam slipped the photos into his jacket without looking. Lucia leaned closer. More in the bedroom, she whispered. I'll help you, Lam promised quietly. You're being very brave. Marco re-entered the room, a pizza box in hand. What are you two whispering about? She told me she's hungry, Lam said smoothly. Which is good. Nutrition is important. See? Marco said with a grin that didn't reach his eyes. I take care of her. Make sure she eats well. He set the pizza on the table and turned back to Lam, his expression shifting again. If you wants Part to put comment in blow,